Now today I'll be taking up a very important topic with you, and the topic is portal vein, portal system anastomosis, and portal hypertension. Basically, first of all, we have to understand the portal vein. It's a topic of immense importance as far as your medicine and surgery are concerned. The basic anatomical knowledge of portal vein is very, very important. So, to start with, you can have a look at the figure, and the figure just shows the course of the portal vein and some branches as well. The first important thing you have to remember about the portal vein is that it is a very important vein, and basically it is not a vein, it is a system in itself. That is why we give this another name as the portal venous system. The importance is so much that, like other systems, the portal vein itself forms a system. Okay? Now, basically, first of all, what is this portal system? The portal system is present at a few places in the body. One is the hypothalamic pituitary axis, and another one is the here. So what is common among those two things? This is that these system of veins begin in one set of capillaries and end in another set of capillaries. So that is what we mean by a portal venous system. The division occurs, and how the division occurs will come in across that. Now I will go just a bit ahead and I will come back to this slide. So, important. These are the points which I have enumerated for you people. First of all, what is portal vein and how is portal vein formed? The portal vein is a very important vein which is formed by the union of two veins. One is the superior mesenteric vein and another is the splenic vein. So two veins, splenic vein and superior mesenteric vein, they come and meet, and that's important. Why do they meet? At the level of neck of the pancreas. Once I was discussing pancreas with you, there I told you in relation to the neck of the pancreas, we have got the formation of the portal vein. And what is more important about the portal vein is that it is the predominant source of blood supply to the liver. Liver is one organ in which the predominant source of blood is not hepatic artery. It is the portal vein, and the portal vein carries roughly 70 to 80% of the blood of the liver. So that's important. So portal vein is a primary source of blood supply to the liver. That's another important point. Now, as far as the portal vein is concerned, the portal vein ascends. That means at the neck of the pancreas there is the formation, then it goes in relation to the duodenum and then goes into the liver. Got it? So the termination is at the liver, and at what place? In the porta hepatis. And what is porta hepatis? Porta hepatis is the hilum of the liver. It is just to the right of the porta hepatis that this portal vein eventually divides and ends. So that's important. So the beginning is at the level of the neck of the pancreas, the termination is in the liver. And what about the liver? I will be coming to that. So that's important. Now, somewhere I told you in previous class as well, dimensions are also important. And as far as this portal vein is concerned, the dimensions of the portal vein are very important, especially from an ultrasound perspective. Okay? So remember that the diameter of the portal vein is 1 to 3 centimeters. Very, very important. This has got a clinical significance which we will be taking up later. Okay? And the length 8 to 13 centimeters. The portal vein is 8 to 13 centimeters in length. So there is a range, it's a good range, and it is diagnosed in length. Now, the termination of the portal vein occurs just in the porta hepatis, just to the right of the porta hepatis. Why? the portal vein divides into the right-sided branch and the left-sided branch. Okay, so that's important. Now, what's important in the liver? In the substance of the liver, the portal vein just deposits, gets distributed and divides. Stop me there. So it divides in the substance of the liver. Why then we have pools of blood, and these are given the name as hepatic sinusoids. Okay? So what happens, that's very important. The blood in the liver is mixed with the branches of the hepatic arteries and the portal veins. And important about the histology of the liver is that the liver has got sinusoids, which we give the name as hepatic sinusoids. So this is something which you have to remember as far as the surgical anatomy of the portal vein is concerned. While it begins, what is the course in relation to the first part of the duodenum, and then while it terminates. So this is a brief thing about the portal vein. In addition to that, most of the veins are characterized by having valves. This portal vein is very important because it is characterized by the absence of valves. It does not have valves. So this is a potentially significant difference from a typical vein. Okay? So this is something about the portal vein. Now, as far as the portal vein is concerned, I told you that it begins in one set of capillaries and it ends in another set of capillaries. Now, why the importance? Why we take it very seriously? Because this portal vein carries blood from the large part of the gastro and the hepatobiliary system. It's very important physiologically. Why? Because you can see the most of the, I need to say, parts of the alimentary tract, okay, they eventually drain their blood into the portal vein. Okay, number one. Number second, the spleen, through splenic vein. Then the gallbladder, I mentioned the hepatobiliary system. Then the pancreas. So basically, blood from the gastrointestinal and the hepatobiliary system drains eventually into the portal vein. And what's important about the portal vein is that this blood has got large amount of toxic metabolites, and liver is one organ which is concerned with detoxification. Okay, isn't it? So liver is one organ which is concerned with detoxification. And you know, the blood from the gut, it is especially venous blood, and it carries so many substances which are to be removed from the body through the liver. So in case there is a problem with the drainage of this venous blood, there can be accumulation of these toxic metabolites, and that's not good for the functioning of the body. So portal venous system, or the portal vein, is highly important because physiologically it carries blood from the hepatobiliary system, predominant parts, and as well as the major part of the alimentary tract. And this blood needs to be detoxified. In case there's a problem with the portal vein, there can be inadequate detoxification of the blood. So that is one part. Now, as far as the course of the portal vein is concerned, I told you duodenum. We divide the course of the portal vein in relation to the duodenum. A part lies beneath the duodenum, a part lies posterior to the duodenum, part lies superior to the duodenum. So three parts: infraduodenal, retroduodenal, and supraduodenal. So portal vein is divided into three parts. You can see over here: infraduodenal, retroduodenal, supraduodenal, in relation to the duodenum. And what is important, the relations of the portal vein vis-a-vis duodenum. So you can just divide into infra, retro, supraduodenal part. And what are the relations in the infraduodenal part? Because now we ascend. Basically we should do things in a systematic manner. So the portal vein ascends in a similar manner. The first part to come across is the infra, the second would be retro behind the duodenum, the third would be supra. So as far as the infraduodenal part is concerned, anteriorly we have the neck of the pancreas naturally because it is formed at the level of the neck of the pancreas. And posteriorly is the inferior vena cava. This is a very important thing. Inferior vena cava forms the postulation of the infraduodenal part. Now the retroduodenal part, anteriorly, once it is retroduodenal, what is there? There's nothing I need to say. Common sense. Duodenum will be anterior naturally. And then the gastroduodenal artery and the common bile duct. Therefore, the anterior relations of the retroduodenal part, and posteriorly, again, we have the inferior vena cava. Now, once we ascend up into the substance of the liver, there is the supraduodenal part, and this lies within the free margin of the lesser omentum. I told you the margins of the porta hepatis are covered by lesser omentum. So it lies within the lesser omentum, and anteriorly there is the bile duct and the hepatic artery. Very important, bile duct and the hepatic artery. So you can see, going back to the figure. Now this is the description of the portal vein. The portal vein, why the portal vein is formed, you can see there's a vein which comes just over here. And this is the superior mesenteric vein. So superior mesenteric vein is a vein which is seen over here, and you can see the splenic vein as well. Predominantly, the splenic vein and the superior mesenteric vein are the two veins which form the portal vein. So this is the superior mesenteric vein. You can see that this is the superior mesenteric vein. This is the superior mesenteric vein, which just comes from below. And this is the splenic vein. And they, at the level of neck or pancreas, form the portal vein. So this is the superior mesenteric vein, this is the splenic vein, and this is the formation of the portal vein, which has got a short course. And then the portal vein divides into the left branch, and the portal vein divides into the right branch. But you have to remember there is another vein, which is the inferior mesenteric vein. And the inferior mesenteric vein drains into the splenic vein. Is it shown over here? It must be. Yeah. So this is the inferior mesenteric vein, and it goes in relation and drains into the splenic vein. So basically, if we say the portal vein is formed by the union of the splenic vein and the superior mesenteric vein and the inferior mesenteric vein draining into the splenic vein. So this is something about the anatomy of the surgical anatomy of the portal vein. Then in here, there are short gastric veins, and you can see the left, and then you can see the capillaries. So over here, these are the capillaries. Now you would tell me, sir, you told us that the portal vein begins in a set of capillaries and ends in a set of capillaries. Yeah, at the end I have shown. So the portal vein ends into the set of capillaries or sinusoids. And here, the superior mesenteric vein also begins in a small set of vessels. Isn't it? You can see it over here. So basically, small vessels form the larger vessels, and that is the characteristic feature of a portal venous system. So this is, you can see now, once we study the arterial territories of the gastrointestinal tract, the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Basically, they are the arteries of the foregut, midgut, and the hindgut. In a similar manner, the venous drainage is also set, which almost corresponds to the arterial supply. Here we are not talking about the arterial supply of the gastrointestinal tract. We are here talking about the venous drainage of the gastrointestinal tract, especially. And you can see how the arrangement of the veins and arteries might differ a bit, because veins sometimes follow a different pattern than the arteries. And this is true of the portal venous system over here. So you have to remember that the portal venous system in here drains a major part of the alimentary tract. And this is the figure which you have to draw, which you have to remember, and you can see the set of capillaries into which the portal vein divides in the, I would say, right and the left branch. So that is another thing about the portal vein. Now, what's important? Why do we give much of importance to the portal vein? Basically, because of the huge area of distribution of the portal vein. The inferior mesenteric vein carries blood from a large part of the distal part of the gastrointestinal tract. The superior mesenteric vein carries blood from a large part of the gastrointestinal tract, proximal parts usually. And the splenic vein, it has a large area, the spleen itself, including the pancreatic area, isn't it? So eventually the blood then goes into the portal vein. And this portal vein, like any other vessel in the body, has got its own pressure. Okay? Any vessel has got a pressure exerted by it on its lateral walls. In the like manner, we have got the blood pressure, isn't it? So we monitor blood pressure. In a similar manner, the portal vein has got a pressure of its own, and that we give the name as portal venous pressure, isn't it? And it is measured in millimeters of mercury. Up to 10 millimeters of mercury is the normal portal venous pressure. But what can happen sometimes, the pressure, like in arterial hypertension, can increase in the portal vein as well. And we give that condition the name as portal venous hypertension. Now, what is important about the portal vein is that this portal vein, though it is a system in itself, but important thing is that it has got anastomosis with the systemic veins. So the systemic veins, what are systemic veins? They are the veins other than the portal venous system. तो portal venous system का एक चीज है that the portal venous system anastomosis with the systemic veins at various places in the body, and that combination or anastomosis of the vessels of the portal vein, branches of the portal vein, once they meet the branches of the systemic veins, those areas are given the name as portosystemic anastomotic sites, or the sites for portosystemic anastomosis. That is a major feature of portal vein, that the portal vein anastomosis with the systemic veins. Does it occur all over the body? No. It occurs at specific sites. And what are the specific sites of portosystemic anastomosis that you have to remember? Very important. The first is the distal end of the esophagus, or near the esophago-gastric junction. So that is one part where we have the portosystemic anastomosis, lower end of esophagus. The second is the umbilicus, which you have studied. The third is the anal canal. Fourth is the clear area of the liver. Fifth is the posterior abdominal wall. And then is the liver. Again, the part of the liver. Now, these are the areas wherein the systemic veins just come in relation to the branches of the portal vein. And why this is important? This will get clear in a short period of time. Understood till now? Is it clear? Any issues? So, this table you have to remember. This is a very important table which you have to remember. There is no other way not to, remember this or to forget it. This is what is asked from you as far as your exams are concerned. And this happens to be a question asked in the form of MCQs in your subsequent exams as well. So how do we come to know about the importance of the things which we have to read? Now, I will just give some examples, and I will just clarify this concept with some examples. Now, there is a person, a patient, who comes to you in your OPD, you are sitting there, and a patient comes in and he tells you, sir, I had bright red bleeding from my mouth. Okay? I'm not talking about hemoptysis. That is cough, no blood. He presents with what? Hematemesis. This is hematemesis. Once, and that blood is characteristically bright red. It's still important. So this patient comes to you, tells you, sir, I am vomiting bright red blood, and he must be in the history, which I will not go deep into because you are not very well in medicine as yet. So there might be some factors in addition which you have to ask me as leading questions, but that knowledge will only come once you have studied medicine. Say I'll give an example that he has been an alcoholic has been drinking for a long period of time alcohol. That's one thing. So what comes to your mind? Nothing as yet. This is one patient. Then there is another patient who tells you, sir, I am having bleeding through my anal canal. Okay? So once I go and I pass the stools, I am having blood with the stools. Number 2. Number 3, we are having an examination of a patient, and we can see that around the umbilicus, that normally there are no veins which are found around the umbilicus, and then over the umbilicus there will be a prominent venous speculum which you see. So these 3 classic examples I take one by one. Now the former one, first one, in which the patient presents with vomiting of blood, and the characteristic was that blood was not brown, it was. What is the importance of asking this question? Now he will say you, I had vomiting of blood. The next question you should come to the doctor's mind was it bright red or was it brownish or brownish blackish? Why? If the blood is mixed with the hydrochloric acid of the stomach, it will change to brown. If it is fresh blood, it will be bright red. So that indicates the source. So if it is the source of bleeding is proximal to the stomach, it will be bright. If it is strong, it is brown. So you can just get an idea of the hemorrhage by knowing the color of the blood. Bright red will indicate a lesion proximal to the stomach. Brownish will indicate a lesion within the stomach. That's one part. Now, what is this relevance over here? Because just now I told you that lower end of esophagus is a site of portosystemic anastomosis. And between what and what? There are from the portal veins, esophageal branches of the left gastric vein. So the esophageal branches of the left gastric vein are the branches of the portal system. And then you have got the esophageal branch of the axillary hemiazygous vein. And hemiazygous vein does not belong to the portal venous system. It belongs to systemic veins. So once these vessels over here, now this patient unfortunately has a portal hypertension. And in portal hypertension, what happens in a normal person, these sites remain normal. They do not open up. But once there is a portal hypertension, these sites open up. And what happens? The lower end of the esophagus, there are those veins which get dilated and then they rupture. And then once ruptured, there occurs bleeding. And why? Because important is that blood is a huge gastric irritant. Stomach does not tolerate blood. Once a patient bleeds or there is a reflux, I would say that the blood is immediately vomited. Before getting mixed with hydrochloric acid, there is vomiting of the blood, and that characteristic is a feature of what we call as esophageal varices. So what are esophageal varices? Is once there is an opening of the collaboration or the venous channels of the portal and the systemic venous over here, and the esophageal branches of the left gastric vein and the esophageal branches of the axillary hemiazygous vein, in case of portal hypertension, they get dilated, ruptured, and the patient presents with vomiting of blood, bright red. There can be 50 different causes of bright red vomiting of blood, which we give the name as hematemesis, but this is one of the causes, very frequent cause. So in the differential diagnosis of bright red vomiting, the important thing is that it is due to esophageal varices. And what are varices? Dilated veins, which open up at the lower end of esophagus, not at the upper end of esophagus. Okay, near the esophagogastric junction, and the patient presents with bright red vomiting. And there's a question asked. These are the reasoning assessment questions which are asked from you. Clinical based questions. In your 5 questions, 4 questions are asked. 5 marks or 4 marks, 20 questions, clinically based scenarios in your final examinations as well as your terminal examinations. So this is one classic example which is asked, and this is given the name as esophageal varices, and the basic cause is portal hypertension. High pressure in the portal venous system, as a result of which veins at the lower end of esophagus open, rupture, and patient presents vomiting of blood. This is from the mouth. Then from the distal end, anal canal, another patient presents with bleeding along with the stools, and then along with that sometimes we have got the visible piles or hemorrhoids seen at the level of anal canal, internally as well as externally. Externally one can feel for them as well. So there are these masses, small dilatations, and which we give the name as hemorrhoids, especially at certain places as far as the clot is concerned. I will not go at this point of time. So what can happen at the distal end of the anal canal? The distal end of the anal canal, while from the superior rectal vein, which is a tributary of the, portal vein, and the middle and the inferior rectal veins, which are parts of the systemic veins, they open up. So there is an opening of the veins which normally do not open once the portal venous pressure is normal. So at portal venous hypertension, there can be bleeding through the rectum anal canal, and what happens as far as the bleeding of the from the distal end is concerned, that again can be a sign of portal venous hypertension. So a patient will present with bleeding through the mouth, a patient will present with bleeding through the rectum and anal canal. So that is given the name as hemorrhoids, and both can be, I don't say they always are, both can be causes of portal hypertension. So basically portal hypertension in itself is not a disease. It is due to certain factors. So portal venous hypertension is then to be evaluated. What is the cause of portal venous hypertension? It is not a disease as such. So there are causes for portal venous hypertension, they are evaluated. But the common pathology with these things is the increase in the portal venous pressure. What? 2. Now, umbilicus. Normally, if you see the umbilicus of an adult, there are no visible veins around the umbilicus. And in case I have already told you once we were discussing umbilicus, there can be opening of the veins. And what veins? The left branch of the portal vein through the umbilical vein, which is from the portal venous system, and the veins of the anterior abdominal wall, which are the systemic veins. So there can be opening of the veins over there, and what they do, they form a radiating pattern which resembles the crown of the Greek goddess Medusa. That is why the name caput means head. Medusa means the Greek goddess, because she was wearing a crown which just resembled the crown on the head of the Greek goddess, who must be beautiful naturally. So I will not comment much on that. So because it resembles the crown on the head of Medusa, beautiful Medusa. Okay, so that is why this radiating pattern of branches over there, and then this is given the name as caput Medusa. So 3 important things. It is just the observation, the clinical examination, the examination of the abdomen. Okay, that can indicate if you see the radiating pattern, then we will evaluate what the cause of portal hypertension was, because this can be a very, significant thing with a lot of morbidity and mortality. Portal venous hypertension needs to be evaluated. Okay, and usually the portal venous hypertension occurs not, I told you, normal portal venous pressure is up to 10 millimeters of mercury. Okay, there are 2 things. So millimeters of mercury or centimeters of water. I am talking in terms of millimeters of mercury. So that's important. But it does not mean that 12 millimeters of mercury is portal hypertension. No, any pressure above 14 millimeters Hg is defined as portal venous hypertension. After 40 we wait. But the normal pressure is still 10. Between 10 to 40, this is the observation. Above 40 millimeters mercury, we give it the name as portal venous hypertension. So that is very, very important for you to remember. Okay. Then there are, I was mentioning you yesterday, bare areas of liver, the areas which are not covered by peritoneum. They are the bare areas, and they are responsible for rapid local transmission of infections because they are not covered by peritoneum. Peritoneum is protective. So these bare areas are, I would say, again the sites of, again, what's the importance of bare areas is twofold. One importance is negative, that they cause rapid spread of infections because of lack of peritoneum. But another important thing is that this is negative, that they are the sites of portal system. And while the hepatic veins merge with the pelican intercostal veins, and that is how this becomes a site of portosystemic anastomosis. And in here also there can be the dilatation of the veins. Then posterior abdominal wall, this is something which you cannot clinically, because posterior abdominal wall you will not be able to see much. So veins of the duodenum ascending in this column, while they meet with the retroperitoneal veins. Okay, the retroperitoneal, the area behind the peritoneum, retroperitoneal space is a very important space from oncological perspective. But here it is also important as far as the site of portosystemic anastomosis is concerned. Then sometimes you know that the ductus venosus may remain patent, and then that connects the left branch of the portal vein with the inferior vena cava. So that's important. So these are some of the sites of portosystemic anastomosis, and this table you have to remember. This is very important because portal veins hypertension, portal vein is an important question frequently asked. So this is something you have to remember. Now, what are the tributaries of the portal vein? The way sometimes the questions are asked as far as the arterial supply is concerned, we have to know the branches and the main important as internal memory artery, anterior cerebral artery, middle cerebral artery, posterior cerebral artery, internal carotid artery, external carotid artery, maxillary artery. These are some of the vessels which are asked as full questions sometimes. What are the branches of these vessels? I was mentioning arteries, but here this is one vein about which you are asked normally. You do not ask the branches of the veins normally. But the portal vein is one vein because of the significance about which we ask you what are the branches of the portal vein. And the branches of the portal vein, naturally, splenomesenteric vein, splenic vein from which it is formed, and then the left gastric vein, the right gastric vein, the cystic vein, the splenomesenteric vein, and the para-umbilical veins. These are the veins, para-umbilical around the umbilicus, isn't it? Now, splenic you know, splenomesenteric you know, inferior mesenteric I mentioned you at the onset. Right gastric vein, cystic vein. Cystic vein drains into the right branch of the termination of the portal vein, which I will show you. Then the splenomesenteric the para-umbilical veins, and the left gastric vein. These are some of the important tributaries of the portal vein, and I will go just back as well so that you have a cystic vein. I told you just now. So it is just merging into the right branch of the portal vein. These are the left gastric veins. Okay. Sometimes they just go in relation to the left branch of the portal vein, or sometimes they directly drain into the portal vein itself. Clear? Inferior mesenteric, I told you just now, it goes in the splenic vein. This is the superior mesenteric vein, which carries the blood, collects the blood from a large part of the gastrointestinal tract, especially from the right side. And the inferior mesenteric vein carries the blood from the left part of the alimentary tract predominantly. So this is a figure which you remember, which you should remember, and this is important. Now, this enumerates basically over here. This is the bare area of the liver. This is the esophagus distal end. This is the beginning of the stomach, esophagogastric junction, umbilicus, anal canal, and this is the spillage of the blood here, and from here there will be vomiting, from here there will be bleeding to the anal canal. So this is from something which is coming at my notes for anatomy, which I have not prepared as yet. So this is a brief prelude to that. So this is something you remember about the portal systemic anastomosis. Okay. Now, as for there's a spelling mistake over there. I can just appreciate that. Now, portal vein. Why from does the portal vein develop? That's important. Though this will be taught in embryology detail, but remember the white line veins. I don't see WHIT. I see VITLN. White line veins. The white line veins are important because the white line veins form the portal vein. How? That will be dealt in an embryology section in detail by the tutor who just teaches you the embryological perspective of the developmentology of the portal vein. So, just a brief recap over here. What we have studied, what the questions asked from you as far as your examinations are concerned. So, number one, portal vein is formed by union of dash and dash. Portal vein is formed at what level? In front of neck of pancreas or behind. So we can just, there's a video going on, so it can be just quiet. Okay? I don't want to be a noisy video, but the thing is that because people other than you will see it, isn't it? I'm just in a prelude. This is what is examiner's mind. Okay? I again repeat it without noise. Portal vein is formed by union of what vein and what vein. This is what is asked in NEET PG. MRCP, MRCS, any damn examination. Portal vein is formed at what level? Portal vein is formed in front of body of pancreas, behind body of pancreas, in front of neck of pancreas, behind neck of pancreas. Things like those. And just give me a quick review type of questions you are asked. Number two. Number third, say, inferior mesotic vein drains ABC, things like those. Portal vein divides at what ends at what level? Portal vein at its termination has dash branches, usually. So two, right and left. Okay? Cystic vein drains into what part of portal vein? Okay? The margins of the porta hepatis are covered by dash. So, in relation to portal vein is divided by what segment of the gut? Jejunum, ileum, duodenum, column. Say what? So this is what is in the examiner's mind. Okay, what is the normal portal venous pressure? What is portal hypertension? At what pressure do we say a patient has got portal hypertension? Okay. Now, I just covered these things, but what about the consequence of portal hypertension? Okay. Now, what happens? You have to remember that once this patient now has got an increased portal venous pressure, so he is a labeled case of portal venous hypertension. So what can be another things which can be associated with this thing is that once there is a portal venous hypertension, what happens? There is congestion at the level of portal veins at different places. So there is a backward flow of blood. And once there is a backward flow of blood, what will happen to the splenic vein? Pressure. It will also get increased. And what will happen to the spleen? Passive congestion. Splenomegaly. Because more of blood will be going back towards the spleen. And over a long period of time, what will happen to the spleen? The spleen will get congested. The spleen will get increased in size. So one of the features of portal venous hypertension is splenomegaly because of the backward flow of blood over a long period of time. Now, there are these other conditions like cirrhosis of liver, like the tropical splenomegaly syndrome, like the Bandy syndrome, and many causes of splenomegaly, but portal venous hypertension can be due to many diseases, and many diseases can be due to portal venous hypertension. And portal venous hypertension is not in itself a disease or a diagnosis. You have to evaluate the basic cause of portal venous hypertension. Because once we go to medicine, then we classify portal venous hypertension into pre-sinusoidal, sinusoidal, and post-sinusoidal causes. That is not for you at this point of time. So there can be many causes, and one thing is portal venous thrombosis. Say the portal vein has got no thrombus within itself. What can happen? What will happen to the blood pressure within the portal vein? It will increase. So portal venous hypertension can be due to many things like portal vein thrombosis. And you have to remember that this is not a disease in itself. It is due to multiple factors, and sometimes many factors come together to cause portal venous hypertension. So coming back to the point, frequent questions asked, what are the manifestations of portal venous hypertension? Okay, so these are the types of questions which are asked from you. What are the sites of portosystemic anastomosis? All of the following are sites of portosystemic anastomosis except A part, proximal end of proximal end of esophagus. B part, distal end of esophagus. C part, bare area of liver. D part, umbilicus. So the answer naturally is the proximal end of the esophagus, because it is not the proximal end, it is the distal end of esophagus. So while doing the MCQs, you have to be pretty oriented. It is not only cramming power, there is the attention which you have to think. What is the word proximal and distal defines the answer. So these, your attention, concentration, judgment, these are all what are tested from you. So these are some of the types of questions which are asked from you as far as the portal vein, portosystemic anastomosis, and the portal venous hypertension are concerned. Okay? So that is something you have to remember about the portal vein and what I just mentioned. Thanks.